Hi, hi to everyone. Welcome to our Sembang Santai in conjunction with the World Glaucoma Week 2024. I am representing from Nation Glaucoma Society, welcoming all of you to this public forum platform, online platform. We are live through Facebook and also YouTube. We are here to just discuss about a disease called glaucoma. And every year, there's the World Glaucoma Week. Second week of March is actually a World Glaucoma Week. And this year, World Glaucoma Week in Malaysia, there's a lot of programs organized by MGS, Malaysian Glaucoma Society. One of the event is actually Sembang Santai. It has four versions. Initially, it was in Malay. Then there's a Tamil version, Mandarin version. Today is an English version. And this platform is going to be like something like a discussion. You can bring any questions related to glaucoma in the comments. Before I start, let me say something about what is glaucoma actually. Actually, when we see a glaucoma, when you Google, it gives you irreversible blindness. One of the leading causes of irreversible blindness in the world is actually glaucoma. And when it comes to the disease, it's a silent thief of sight. Most of our patients, they don't know they got a glaucoma. Like, remember, a thief come to our house, he never give us any appointment. Suddenly, one day we realize our belongings is missing or stolen. Then only we realize something is missing. Missing properties, missing belongings, we can recover back. But in the eyesight, if you lose your sight due to glaucoma, it is irreversible. So we are going to give some awareness. That's why World Glaucoma Associations, they made a yearly event, not a one day, it's a 1 week event to create awareness among the public. And this year theme is uniting for a glaucoma-free world. We want to make this world free from a disease called a glaucoma. Because of why? Because it's a irreversible blindness, irreversible damage to the optic nerve. And even we had a very sophisticated, very advanced technology in medicine, but it still cannot reverse whatever damage occurs due to glaucoma. So that's about the disease. And how about who will get this disease? Usually there's a few risk factors that we can check online. I usually tell everyone, do a self-assessment. You can use online platform, check. There's a lot of assessment that we can do self. No need to see a doctor first. Do a self-assessment whether you are fall in within this high risk group of getting glaucoma. When come to age, no one is spared. The baby born until you go back, all level of ages are risk to get a glaucoma. But most of our glaucoma that we see are usually at older age, usually at age of 40 and above. And any family history is also a strong risk factor to get a glaucoma. If you got any other systemic problems like diabetes, cholesterol, hypertension, also you got the risk of getting a glaucoma. If those patients who are using medicine called steroid because of some other problems, or buy steroid drops from the counter, without knowing, you are putting yourself into a risk to get a glaucoma. And those who are wearing glass, if your glass is thicker, the more thick, more risk you get a glaucoma. Any blunt injury, also a risk factor to get a glaucoma. This is just an introduction. All the details about this risk factor you can get from the glaucoma. My humble request is try, do a self-assessment, check whether you are in which category, you are in a risk of getting glaucoma or not. If you think you got more risk factors in your list, then you must do a eye checkup to rule out there's no glaucoma. And Malaysian Glaucoma Society, in our web page, Facebook, you can get, during the month of March, you can find there's a lot of centers are doing a free eye screening. You can come and join, get your eye checked. Don't assume you got no disease. Check and confirm that you got no glaucoma. And let's come. This is actually Sembang Santai. We're going to be relaxed, talk about the glaucoma. In this platform, there's going to be another doctor, Dr. David Wu, and he is a consultant ophthalmology and glaucoma specialist, Isaac Kuala Lumpur. Both of us will chair this program. Let's me welcome Dr. David.
Hi, everyone. Good evening. Thank you, Dr. Suresh, for the kind introduction and also for the invitation to speak to attend, really, by the organizers. This is a very good opportunity for all of us to have a good chat about this condition. Dr. Suresh has already mentioned this is a silent condition. It can take away your vision. The earlier we know about it, the more we can do to try and preserve your vision. So it's all about awareness, awareness, and awareness. We've got two lovely patients with us this evening as well. Big thank you to them for taking the time to be with us. So I'll leave Dr. Suresh to introduce our lovely patients for this evening.
Thank you, David. Let's welcome our two patients are willing to come with us in this platform to share their experience, Mr. Daniel and Ms. Dalbinder.
Hello, good evening, everybody.
Good evening, everyone.
Thank you, Dr. Suresh, for inviting us. Pleasure to be in this platform, Doctor.
Okay. So let's start with about glaucoma. What do you think about glaucoma, Mr. Daniel, from your point of view?
Well, in my point of view, glaucoma is kind of an alien word for me. In the beginning, when I came to know that I have glaucoma, what is glaucoma? Oh my God, what is this all about? And when the doctor was actually telling me, like 9 years ago, I had this. When I drive car, most of the time I feel like something is blocking me, on my right hand side. And I told this to doctor, and doctor immediately said, I know what you have, but let's do a serious test. But when I heard this alien word, it kind of a bombshell, like I realized that it was like, is this the end of my eyesight? And of course, he assured me at that point of time, no, it's not the end, but life has to go on. But you have to go for regular treatment and stuff like that and so on. But then it was very discouraging, very, very, very demotivating at the point of time. Being a person in that age category and growing up, and suddenly you say in times to come you will go blind. Oh my God! If I'm out of, I don't have a right hand, I don't have a left hand, I can do something, but without eyesight, there's so many things. Like it's a real Hiroshima Nagasaki bombshell that has dropped on me. Just a word, as you asked me, what is glaucoma? Alien word that I came to know in this world. Never even thought that I would be having glaucoma from whatever reason. But nevertheless, thank you, doctor. Yeah, just to share what is glaucoma, what it means to me. Yeah.
So you agree that it's actually a silent thief, it silently take away your eyesight. So
yes.
Then you already got the disease. So how about Ms. Dalbinder? What is your point of view about glaucoma?
Okay, hi, good evening, everyone. Okay, I was diagnosed with glaucoma 12 years ago. I was 41, so I fit one of the categories there, 40 above. Okay, how did I find out all about it? Just like for Mr. Daniel, it was an alien word for me. When we were young, we actually knew that anybody with all the old uncle and aunties, they come back from the hospital wearing the black glasses, they have done something with the eyes. And I thought it was something like that too, because Nobody, I mean, 12 years ago, I think nobody knew all these words, glaucoma and all that. I actually went to a private doctor to get my eyes. I wanted to do LASIK treatment because I was becoming, very beauty conscious. You want to remove your glasses and look good and all that. Not knowing, like Mr. Dan said, Hiroshima bomb came dropping on my head. I was told that I have glaucoma. And then I asked the doctor what is glaucoma. He explained, but at that time you don't digest anything. What is this? What way? Not flowing? This that. And to make matters worse, when I came out from the doctor's room, the kindest nurse in the whole entire world told me, glaucoma patients go blind. Okay lah. Then started the Bollywood drama, crying, 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 go back home and all that. And then I started doing my own research, and I also realized I was given a big packet of eye drops for this, for that, and all that. Um, it was very straining, especially mentally, emotionally, that you can go blind. You can go blind. But I think I have just been lucky that I did not give up on myself, and the doctors also kept treating me and on and on and on till I'm here today. I've gone through quite a lot, I would say, quite a lot. But yes, to a certain extent, yes, your eyesight will be affected, but it can be saved if you do something about it. It's not the end of the world. That's it.
So, so both of you actually you don't realize you got a glaucoma. Miss Delvinda was diagnosed accidentally. She went for some eye services, and the doctor said, "No, you cannot do the LASIK, but you got new problem in your eye." And Mr. Daniel was while driving, you notice your confidence of driving is reduced.
Exactly.
Then you went to see that.
That was my triggering point. There's something wrong with me. Why am I? I used to be a speed driver on the highway, and suddenly now I'm slowing. Automatically, I slow down. I don't realize actually what's wrong with me. I always feel that something is blocking me. Yeah, something is like a layer blocking on my right hand side. So that's where, of course, having then when after going through check, yeah, my right hand side was actually was the major damage compared to my right hand side. Yeah. That's how I knew. That's how the alien word came into my life.
How about they say? Do you have any eye pain prior to this? No headache or what?
No,
Unexplained headache.
no.
Eye
In
ache.
my in my case, I mean, as for me, I never had any except for that kind of range, as kind of that kind of formality that was with me, but I have never had any eye pain or headache or something wrong with me or stuff like that. I even thought maybe it could be my eyesight glasses, but that was not a worry at all. Even when I went and checked, I say everything is the same, and why do you need to change your glasses? So I thought, oh, something wrong with me. Then it go. Someone said, why don't you go for an eye checkup and real eye checkup? I mean, literally, I know a man has high blood pressure and a pressure test and blah, blah. You do a pressure test for the eye. I was like, huh, okay, this is something new. So all these were doing a pressure test on your eye and to see the eye also has a certain limit of pressures. Within this range is good, within that range is moderate, and within this range is need to be like that and things like that. I was like, what, pressure test for my eyes? And then you have to put the drops and then open up your eyes, and then the doctor was putting the thing right in front of you, was like, come near, closer, look at the light. Which light? Look at the light. Which light? I can't even see the light. And they say, look at this light. Can you see the blinking light? And I said, no, doctor, I really can't see the blinking light. No. So this kind of phenomena experience when I went through, I was like, wow, okay, something is really wrong with me. But of course, the doctor assured me, like how Miss Blinda said, it can be saved if you do the right thing. If I would have just kept quiet, no, I shouldn't have gone to the specialist, eye specialist, or even to see Dr. Suresh later part of my life, and I would have just stayed there. I didn't know what kind of damage that I myself would have brought to myself if I wouldn't have gone at that point of time. I'm talking about 9 years ago, 9 years ago. Yeah, doctor. Yeah, that was my experience. I really felt my driving, it really happens to me when I was driving. Literally, it was going on for like about few months until I gave up and say I must go and see a specialist. I mean, I must go and see an eye doctor to rule out what was wrong with me. So that was my triggering point, actually. Doctor.
Okay, well, thank you for the sharing. So essentially, just to let everyone know, the glaucoma is one of the biggest causes of blindness globally. I think if you go by estimates, maybe the WHO estimates is about 80 million globally in 2020, and that's going to climb all the way up to about 110, 120 million in the next 20 years. And a lot of people don't realize, again, according to some of the estimates, at 40 years old, I think the risk, all things being equal, is about maybe 1% or less of developing glaucoma. And when you hit the age of about 65 and above, that percentage can actually go up to anything from 6 to 8% estimated. So there's a lot of people potentially with glaucoma. So in a room full of 100 people who are above 65, you may have about 7 or 8 of them with glaucoma who are actively losing vision. And even in very developed countries like the US, it's estimated maybe about 80 to 90% of people have no idea they have glaucoma. So this is a very, very big problem. And Dr. Suresh will confirm, hopefully, that it is a big problem for us here in Malaysia. Number one, I don't think we have anywhere near enough glaucoma specialists. Number two, the need for glaucoma specialists will go up. And the earlier we know about it, the better. But and the two patients we have here, Ms. Dalbinder and Mr. Daniel, they're very different in terms of how they came to know about glaucoma. One of them, Ms. Dalbinder, was early on in the process, fairly early, right? No visual loss, nothing. And then Mr. Daniel lost vision already. And generally, I always tell my patients, if you already lost vision and you're noticing the loss of vision, you probably will have lost anything from 70 to 80% of your vision, 60% at least. And then it's an uphill struggle to try and keep the vision. For both patients, maybe Ms. Dalbinder, you mentioned earlier on, I think it was in the background, that you're kind of like a platinum card holder for the local eye clinics. How often do you normally have to go for follow-up? Do you think it's a big problem? Do you build that into your routine?
Okay. Lately it's been like every 2 months once, but there previously, I was talking about 2 to 3 years ago, it used to be on weekly basis. There'll be times like the pressure will be high and then it'll come down, it'll go up again and all that. It was I would say it has been a very tiresome kind of process where every time the doctors will need to change the eye drops, and some of the eye drops I couldn't agree, it caused a rash and all that. So from time to time on weekly basis and all that. So it was a very a difficult process, but then again, you just have to keep going, because I believe that everybody's journey in this glaucoma is a bit different. Like how I discovered and how Mr. Daniel discovered, it was 2 different ways. And I have very high astig, so all interferes together. So weekly basis, but now it's been my eyes have been behaving, especially my left eye is the one. So it's like every 2 months once. Yeah.
And what about Mr. Daniel? What is your follow-up schedule like at the moment?
I mean, I'm a very quarterly, every 3 months once I go back to Dr. Suresh for a checkup, and then also for a full checkup as well. But lately, for the past, just very lately, for the past 3 months, my pressure seems to have actually deteriorated for whatever reason. I don't know why. And then we changed our timing of putting up the drops. Then it came back to normal. So that was like on a monthly basis. Just 2 months we tried that scenario. That was sort of 2 months again. So I'm back to every quarter, every 3 months once. I'm having a follow up. One is a normal regular follow up, for pressure tests and stuff like that. and then one will be a full time. But more importantly, whether it's going to be a regular checkup or whether it's going to be a full checkup, whether it's going to be monthly or what, if I as in a person, if I do not use my drops as I was supposed to use, then I'm only helping myself to bring in more danger to my side. So that's how, because I mean I have come to acceptance level that drops is very important to me. So even if I'm traveling outstation, I'm traveling abroad, I have to have my drops with me, and had to
Exactly.
and I have to put the drops wherever I am, whether I'm traveling, whether I'm in the car, or whether I'm in a theater. I have to apply the drops for that timing, just to make sure, because it only lasts you about 5-10 minutes, but that 5-10 minutes will actually will help you to extend your eyesight for another period of time. So that's me. Having said this, Dr. David, yeah, there are times that I've come monthly. There are times I've come regularly, quarterly, and so on. So now it's actually, and my next appointment is in April, so it's in another month's time. I'll be coming back for my full checkup, actually, Dr. David.
Thank
Yeah,
you.
I think the drops are very important. I agree a lot with Mr. Daniel because I think just like Mr. David, I'm also very religious with the drops. Okay, no matter what, if I'm traveling, I always have two sets of both. I actually spend my own money and buy, and I keep aside. I just get very actually I don't like the sometimes the attitude of some patients coming that they ran out of drops, they didn't come and take it. The attitude that the tidak apa attitude can actually just keep you losing your vision. I think people got to buck up on that. Your eye drops are given for a reason. It really helps to keep your pressure at a steady point. So if you are running out of eye drops, please do not take it very easily or lightly. You got to have that always with you and put it as how the doctors have advised you. Yeah.
Having said that, also, Dr. David, just to share, I think Dr. Suresh also fully aware. There are times that sometimes I miss the timing. There are times, I mean, I mean, to be truthful, right? So there are times, sometimes out of tiredness, I just doze off. So at night I forgot. Oh, next morning I realized I didn't take my drops at night. So there were times, not to deny the fact that it is not that you did it ignorantly, but unignorantly. You don't realize that. So, but some or other, the tendency of it's a routine thing that have to be taken, has to be taken. Yeah. But having said that, there were times that I also missed my timing, and the next day I realized, oh, I have not taken. I also admittably have even admitted to Dr. Suresh, Doctor, for the last 2 weeks, I know I didn't, I have missed my timing. So that when he does the test, he knows why the results are not showing. Because I'm sure when, you guys being the doctors, when you do the test, hey, Daniel, you don't come and talk stories to me, okay? You know what I mean, Dr. David. Sorry, Dr. Suresh, I'm just being transparent here, right? Yeah.
No problem. No.
Well, thank you
So,
both for those great answers. Dr. Suresh, you want to say something?
So both of you, no, I think both of you use many bottles to how maybe you're using combinations. What's your experience using the multiple few bottles with the now maybe with the combination? Do you think there's any difference?
No, I know. I remember my drops. Like, I've taken Deodorant, I've taken Simbriza, now I'm taking Gangfort, and so on and so forth. But yeah, I was so used to Deodorant. Then, sometimes then I have stopped taking Deodorant now. I'm on Simbriza and Gangfort. But having said that, because as a patient, I take the medicines. So I just to take the medicines regularly, because that's my duty to take the drops. But then only when I'm told that, at a certain period of time, that you need to now change to another drop, and I'm explained, I was also explained, like in this case, doctor, why we are changing from zone A to zone B now. So having said that, yeah, like, when I changed from Deodorant to Zimbriza, there was the kind of itchy feeling, rash, the harshness, and like my wife will ask me, why are you crying, and so on. It's not I'm crying, the moment I put the drops, the eye seems to be not adapting to it, but eventually got adapted to it. So yeah, early days there were a little challenge. I won't say struggle, because got used to it, right? Got no choice. I have to take it for the benefit of me. So I have to go through. But that was only for about a week, 2 weeks. After that, I'm immune to it. Then I'm fine. So similarly and so on. Only thing, when prior to that, we were doing like 12 hours, 12 hours, 12 hours. Now it's going to be 8 hours, 8 hours. So that synchronizing of the timing, sometimes, due to certain responsibilities or other roles, we tend to you lose the timing. So, but yeah, so it helps a lot, the drops, because I mean, I have to hear what my doctor says. So when it helps a lot, and I'm satisfied when I see the results are shown better. So that shows I as a patient, I've listened to my advisor what to do, and I've done that. So psychically, when I come here, of course, there's always a psychological fear. Oh my God, how my results going to be, and how my results going to be, behind my backstage, that's killing me. And then when the doctor tells, yeah, today the pressure is at 10 and 11. Okay, thank you, Lord, so that's how it goes. So yeah, doctor, that's my experience on taking the drops and so on. Yeah.
I mean, Mr. Binder, do you think the single, a few, many bottles with now maybe a few bottles, how do you think the difference?
Troublesome.
Troublesome.
You have to like get them all into your eyes, and like in the morning, every time I'm rushing, like they will say like, wait few minutes, I don't have the time. I just like go on, putting. And okay, on weekends I have more time, so I do that 5 minutes thing and all that. But yeah, like I can't agree with one eye drop. There's alphagun. It causes like a rash and really extreme itchiness. But otherwise, the rest are quite okay lah. I mean, I have to take it for my treatment, so it's just part of me lah. It's just like my identity now. Eye drops are my identity. I go anywhere, I need them. Yeah.
Thank you. I just wanted to pick up, if I may, on a few very, very important points raised by both patients. Actually, this is a condition which is very, very complex. It's a condition which damages the nerve. But the only thing that we can do to stop patients losing vision is to lower the pressure inside the eye. There's a lot of work going on towards a lot of other aspects of trying to save the sight. But at the moment, all we have are either eye drops, which these patients are using regularly and daily and long term. There are some lasers that can be performed, and some larger and some more minor operations that can be used as well. And the treatment is not something that we take lightly. Dr. Suresh and I, we don't like to say to someone, you need to go on treatment for glaucoma, because that means we think that you have a risk of losing vision in your lifetime if we don't do anything. So it's not an easy decision to make, because then the patients have to go on to use eye drops, to have operations, follow-ups for the rest of their life. So the burden of the disease is very strong. Also, everyone's different, as Ms. Dalbinder said. No one size fits all. There's no such thing as a normal or an abnormal pressure. You can have patients with very high pressures who are okay. You can have patients who have very, very low pressure. They're still getting worse. Very unlucky patients. So it's something that has to be tailored according to the patient. And the more we see the patients, the more we understand each individual patient and their eyes, and then we find the solution that works best for them. It's really a journey that the doctor and the patient walks together. So the trust has to be there from the start, all the way.
So since we got two patients here, when you diagnose as a glaucoma, did you check your family members to know whether you got any your family members glaucoma? Did you do any self-assessment? How many risk factors you got? Or go online, check online?
Well, in my case, I mean, when I was told to do this, my mom passed away, so I do not know whether she my dad have, because they all passed away, so I didn't know. But then to all the other siblings, none of them have, except for me. So I reckoned that probably my mother and my dad could have had it in their old age, which were not told to us, or they do not realize that they were actually having it, prior to their death and so on and so forth. But to what I know, none of my siblings have them except for me. Because I was asked this question, Dr. Suresh asked, what about your thing? And then I said the same thing, because as I know, none of my siblings has them. But because of course my parents died at old age, so whether they knew about it or whether they didn't realize or ignorantly they kept quiet about it, I can't answer this, Dr. Suresh. Yeah.
Yeah,
How
the
about
same with me. My grandmother, my late grandmother, my paternal grandmother, she did one eye surgery. I suppose that was cataracts, and she was a diabetic patient too. So, but nothing that glaucoma was ever mentioned, because, like I say, it's 12 years ago, and even to me it was alien. So what else to that age group? And then but I had asthma when I was young, and I don't know, somewhere along the lines I read that asthma patients have this tendency to get into these eye problems and all that. But I don't know if that is true. But when it comes to my siblings, of seven, none of them, it's only me. I'm the eldest, and I think I'm super special, so that's why I have it. But now my mom, like, she's 72. She has just been diagnosed, but that is, I think, something to do age related. But for me, it's God gifted. It's like my journey with glaucoma is like, wow, the number of needlings, even like Dr. Suresh, you can see very anxious patient. So it's been tough, lah, tough. But when it comes to family history, this is the only specimen with glaucoma.
how about the children? Do you worry about your children? They might get the glaucoma.
Both my kids wear glasses, and yes, I do worry. Actually, yes, the worry is there. But so far, so good.
No,
Yeah,
actually, we
I
have to
don't see any signs, but maybe
reassess the
must let them
risk
check.
factors. How about Mr.
Yeah.
Daniel? How about treating your children?
Yeah, it's I never thought of it. Thank you for raising up. I
Yeah,
think
actually.
yeah, thank you for raising. I never thought of it actually. Yeah, I think I should bring my son. He just finished his SPM. I think he should come and do just to rule
The
out.
tests.
Yeah. Yes. Thank you, doctor, for raising this. I think I should do that. I never had a thought of that because I was only considering had been selfish, only looking after myself.
We are so immersed in our eye drops, we don't know what's happening
Yeah.
outside.
Because follow our team, we
Yeah.
want to glaucoma-free world. So we want to stop the disease. Whoever got the disease, we stop. And the next generation, what we want is they do a self-assessment before come to see a do a self-assessment. There's a lot of, you can get information online, do a self-assessment and see where you are standing.
I
Is
see.
it in the no risk, more risk, whatever the risk stratification. And from there we move. Maybe we can go a simple eye screening. Every March, just online. Those who are online, please check in our glaucoma, Malaysian Glaucoma Society, Facebook. Every year in the month of March, there's a lot of free eye screening, specific glaucoma eye screening, and then people can come and do the screening to those of family members to do the screening.
For the past
And
12
then,
years, now that I've been coming to the clinic very often, I see younger group of people coming in with glaucoma, and it's actually a very worrying trend.
Okay, I think we have a question from Facebook from Mr. Steven Sim. Thank you so much. Is there a difference, Dr. Suresh, between original branded eye drops and local or generic branded eye drops?
The active ingredients are the same. Okay, when I won't say there's no difference. Yes, there's some difference in the branded and also local brand. But when it comes to the active ingredients of the drops, both are same. There's some other difference in the transporter, the preservative that used in the drops and make patients to use more easily, less complications, less side effects. So this is the difference actually. But when it comes to active ingredients in both original or local brand, the active ingredients are same. Only thing is the extra features lah. That's what from my point of view. And don't see the brand actually. No, we want to because sometimes even when you use a branded eye drops, it doesn't respond.
Yeah.
So it's a very individual. If your intraocular pressure is responding well with a particular brand or particular whatever the local or what branded, that's the best medication for you. Don't compare to your friends or whoever sitting beside you in the clinic. For them, it's a different. Maybe that brand or that particular drops is works for. It's not safe. That's my point. How about Dr. Lee?
I agree. The ingredients are supposed to be the same, and certainly when I was in the UK, the preference was to use generics, so non-branded, because it was felt to be more cost-effective. There are constituents which may be different, buffers and so on. While we're here, I want to point out that there are two different types of drops. One, so a lot of the drops come in little bottles which can last you for 28 days. And then some of them are single use. Now, the single use ones tend to be just branded ones. And the single use ones are actually preservative free. And the bottle ones are preserved. So there are preservatives in them. So that's why you can keep them for 28 days. Now, preservatives are, for lack of a better term, they're a little bit like detergent. So the longer you use them, the more you use them, it can contribute to a lot of dry eye symptoms, stinging, redness. So in some instances, your glaucoma specialist may switch you to preservative-free drops. And that's the only other difference you need to be aware of in terms of eye drops. Otherwise, they're all pretty much the same. Good question. Thank you.
Good question, Mr. Steven. Okay, now, so from, I think, Ms. Dalvinder, you had a surgery. Can you, why why you moved to the surgery, your medication is not responded, is it?
Yes.
The reason you moved to, is it the reason moved to surgery because some patients, because the eye is red, a lot of drops, they are not, cannot take the side effect of the drops, so they might do a surgery for. In your case, why we did the surgery?
What I understand is when my pressure is not doing good in that eye, especially my left eye, for both my eyes I've done Trevec and also the cataract surgery, which came in much earlier. My right eye behaved, but my left didn't. So there has been a number of needling done, and the last was it last year or the year before? I actually got a tube inserted into my eye, and I will not say it's not the eye drops, but it's just that the eye is not. I would say the eye is very naughty, not behaving itself. I don't know for what. Left eye is just terrible. It'll be good, and then that's it. It'll go crazy again. It'll be good, it'll go crazy again. So it's like that.
After the surgery, now it's more stable, all right? More stable.
Sort of,
After the-
yes, sort of. I mean, after the stent insertion, 2 months very good. After it went crazy again, and then it changed the medication again, and then it got stable again, and then yeah, it's been like a very roller coaster kind of ride. Despite being very timely with the eye drops, but sometimes I don't know, it's maybe the age factor, or I don't know, it's just too many things. Sometimes we also don't know. But I know every time I visit the eye clinic and the minute they bring that, what is it called, tonometer, stone something?
The
Uh,
truth,
oh my God. It's the moment of truth. I always tell that. Play some drums. And when the doctor says 16, yeah. And if it's
So
20,
both of you, I mean, whenever you go and see a doctor, did you ask what's the your current pressure? Did you ask the doctor?
yes, we do. Yes, we do.
Yes, I do. Yeah.
And
Is
I
it
think it's
give you
important to know as well. I think it's
peace of
important
mind?
to know.
Sorry.
Sorry, go ahead, Dr. Suresh. I think we're clashing a bit.
Do you think the number when the doctor saying the numbers is it disturbing your mind?
It does. It
It
does.
does. It does
Yes.
automatically because we all want the numbers to be below 10, right? So,
I hear anything within 10 to 15 is like, wow, it's like Deepavali for me already. But
really,
anything
yeah.
more than 20, I know really danger once again.
Yeah. In my case, I was like between like, 9, 10, 11, 12. That was my readings. 9, 10, 11, 9, 10, 11. Suddenly, in December and January, the readings went up to 17, 18, 19. I was like, what? And although regularly I've been doing like 12 hours, well, the confidence was always there. Oh, I know it's going to be between 9, 10, 11. That's how. But suddenly, of course, when I asked why, of course, age factor, as we're growing old, the tendency of the immunization is not really strongly activating. But nevertheless, when the method was changed, then I came back to in my last check. I think, if I'm not mistaken, it was between like uh, 13, 14 or 12, 13, 14, somewhere around there. So like below 15. So of course, uh, for me, who I've actually experienced the region between 7, 8, 9, 10, suddenly going into 11, 12, 13, 14, 15, it's like, hey, this is not right. So I need to drop back. I need to drop back. So I don't know what you call them, because Dr. Suresh taught me to do this thing. I know what's the name of
Yes,
it.
yes, yes, yes.
Yeah. So that momentum works. That steps of it works. Counting 30 seconds and counting 60 seconds. So it helps. So these are the things that actually motivate. So to answer your question, Dr. Suresh, so every time I look forward without me asking, a doctor will tell me what the numbers is going to be. So without me asking what the number is going to be, so even the doctor does not tell me. I ask doctor, what are the pressures today? So then he tells, oh, today is at 12, 13. So still need to drop down. Yeah, because the numbers do make, because we are already in this world. So whatever, having said that pressure tells us where we are. The pressure numbers tells us where we are. So every time we do a test, and we know our pressure numbers are such, and the previous results was there, and you expect always to be lower, you don't expect the number to be higher. So the number is to be higher, then hey, something is not right. So this is where I come. For me, the number plays a lot of difference
Yes.
to me, because that's a satisfaction tone. So when I leave the clinic and I know I drive home safely, happily, enjoyingly, and stuff like that. So the moment before my wife could even utter a word, I say, "Don't worry, everything is fine. The numbers are good today. So we can have a good lunch, or we can have a good dinner. So that stimulates
Yes.
me.
Yes, yes.
So that's the happiness, Dr. Suresh, to respond to you.
So we take the question.
Important to remember that pressure, yes, it's a number, but also pressure changes with time throughout the day. So if you have your pressure checked at 4 a.m. and 4 p.m., they'll be completely different. And very often for me, I'm not sure about Dr. Suresh, for me, it's very it's more worrying to see a patient fluctuate. So if they come in and they got a pressure of 10 one time, and then they got a pressure of 18 the second time, it means that they're fluctuating a lot. That is even more worrying. And just maybe another theory about why sometimes medications stop working. The body is also an evolving living thing. The body today is not the same as yesterday. So the response to the drug molecules may also be a little bit different as well. It's no fault of the patients at all, and very often it's just the way things are. But that's just what I wanted to say. As Dr. Suresh said, that there's another couple of questions. So Dr. Suresh, severe glaucoma patients with high pressure, 29 to 36, that's pretty gaming. Okay, what are the risks of proceeding with an eye operation? And which hospital or specialist in Klang has a complete facility for glaucoma treatment?
Actually, when the pressure for severe glaucoma, the stage severe means the damage is really a lot. Remaining nerve fiber is actually very less, and we don't want to take any risk. 29 to 36 is really high pressure. I don't know whether the patient is on medications or already done any surgery. I think we haven't done any surgery yet. First, 29 to 36, we have to make sure it's a true pressure, and we have to check with the patient. If the patient never done any surgeries, as Ms. Dalbinder and Daniel, they know, we have to check whether the patient put the drops correctly or not. The technique of putting and the regularity of putting the eye drops is very, very important, because I think Miss Dalbinder will be agree with me, because she already done Trabec, needling. She thought when she went for Trabec, she thought
Yes,
problem settled,
yes.
but no, end up doing needling. Few
No, it
times
didn't.
doing needling. Then now put the tube. Even with the put tube also, she bit. No, the fluctuation is still there. So first,
Yes.
before we move to the second level of doing a surgical intervention, the pressure is true pressure or not. How about, we can say a lot of things in this with the patient, but executing the treatment is the patient. And patient, when execute the treatments, they should follow the regularly. I mean, the technique must be correct. So all this we have to check whether the treatment really fail or not. If treatments fail, then of course we have to bring down the pressure with other than that, not medical treatment, that we can do a laser, like how Dr. David say, we can do laser, we can do ultrasound, UCP, we can do minimal invasive glaucoma surgery, or we can put a tube, a Trabec. There's a lot of surgeries available, but before we go into the next level, we have to assess and make sure the patient is actually a compliance patient, really medically fail, then we move on. But the process we have to do fast, because it's a severe glaucoma. We won't take, very longer time to assess, reassess. No, we do quite fast. But before that, we have to make sure the pressure is 29-36 is the true pressure, truly high pressure. And then Dr. David is here. He's from Klang Valley, Isaac, KL. So apart from these private centers, remember in Klang Valley, we got a glaucoma center in Hospital Kuala Lumpur, Hospital Selayang, Hospital Klang. So these are the hospital centers that you can go and get the glaucoma. Over all the hospital that I mentioned, is actually a glaucoma center.
Yeah,
But from that, other hospital.
Yeah, we're very lucky actually in Malaysia that we have a very close, very vibrant community in terms of glaucoma specialists. And any of the main hospitals in Klang Valley should do. It will be fine. We've got very experienced doctors who'll be able to do a lot of the operations required. Risks are obviously there for every operation, but if your glaucoma doctor is suggesting an operation, it means only one thing, especially with severe glaucoma, it means that if they don't do something, you run the risk of losing your vision. And if they do something, you have a small chance of making it worse, but a very good chance of stabilizing things. So it's just one of those situations you never hope you end up in. But if you do, in Malaysia, we have, we're very lucky. We've got a collection of very, very experienced glaucoma specialists. So you're in good hands either way. Any supplements? Sorry, yes.
The supplements. Supplement to improve or reduce glaucoma IOP. Supplement to reduce glaucoma IOP, I don't think so. There is, but supplement to neuroprotection. There's a lot of. When I was in Korea, they use a ginseng over there. My prof used to give ginseng, and he said from his studies, from its clinical evidence, the ginseng has some role. It's not reduce glaucoma myopia. It is more on the neuroprotections of the nerve. Even though there's a fluctuation of intraocular pressure, so there's a neuroprotection. There's less incidence of nerve damage.
I do take omega tablets. That I don't know if it helps, but I think it's okay.
You are taking omega tablet?
Yes, capsules.
How
I
is your
tried so
experience?
many.
Do
Uh,
you, do you,
Hello.
Yep, we can hear you. We can hear you.
come.
Um, my experience. Okay, there was a month, I think, in January, that my pressure went up to about 26, 27. And then, I mean, it's very frustrating as usual. And then, all the eye drops, I felt like, oh no. And then my doctor already said, okay, next you're going for laser already. I think basically I've tried everything. I have to just tick the box and what I haven't done. Then I said, no, look, there got to be something I have to do. So I read here and there, and then, okay, omega. So I started taking, and then exactly 1 month after that, my eyes it behaved and it came to half of that. So it came to like 14, 15. So I don't want to like say that it's a final verdict that omega works, and maybe it does. I don't know.
I think
Maybe.
while we're on supplements, I need to maybe again we need to be careful, Dr. Suresh, because supplements. There are a lot of supplements that are available online, direct
Yes.
selling. Uh, uncles and aunties, well-meaning, passing it to you. You got to be really careful with these supplements because you never really know what's in these supplements, and a lot of them
Yes.
they do contain steroids, which will push the pressures in your eyes through the roof.
Yes.
So if it's
Exactly.
not from a mainstream pharmacy, certified to be safe, please don't buy all these supplements and magic pills because we have seen a lot of patients run into trouble with their glaucoma by virtue of taking all these supplements.
Yeah.
So be very careful what you're putting into your mouth.
There's one question about this and need to be aware of patient who has both glaucoma and cataract. For me, when these two actually, when we put these two eye problems, glaucoma is irreversible, cataract is reversible. So the most important is we have to see which is more severe when the patient has these two eye problems. If just say the patient has a more glaucoma problem, then of course when we do a glaucoma surgery together with that, we might remove the cataract. If just say the glaucoma is under control, we first remove the cataract and observe and see. Later we do surgery. But this is still, we have to assess patients' risk factors and the disease conditions, what stage of the glaucoma is now. It's because nowadays when we do a cataract surgery, we do a combined surgery with a minimally invasive glaucoma surgery. With currently this current practice, it gives a good numbers. It reduces the patient's drop dependence. Maybe the more bottles become less bottles need to put daily for control intraocular pressure. So risk is both surgery as a risk because the eye never same. Patient to patient, the eye is different. Even cataract also can get a complication, end up with the glaucoma, secondary glaucoma. When we do a glaucoma surgery, also can trigger the cataract process become more severe
Mm.
and affect the vision. So the risk is both are almost same. Only difference is glaucoma is irreversible blindness, whereas cataract is a reversible blindness where it can be reverse the eyesight. So that's my point of view.
There is also
And
one particular type of glaucoma where actually it's caused by cataract. It's very common in Asia, East Asia. So in that instance, your surgeon might suggest taking the cataract out straight to treat the glaucoma, which is very nice to do actually in those instances.
I've got my cataracts also done both eyes. because but when both my eyes, the eye pressure was at a very stable number, only then it was done. Because uh, it became quite a problem, imagine glaucoma plus cataracts. It was difficult.
Okay, now we go to the second question. Is it? Diamox. I think Diamox is it. Diamox. I have seen this medicine does not reduce the IOP, but the glaucoma suffer with eye swelling, infection, with white discharge. Besides Diamox and other medicine, I'm not so sure what is the question is about.
Is it that sweet
Diamox.
liquid?
Diamox is a really, really strong and potent reducer of pressures. So if the Diamox is not working, something is wrong. Diamox is one of our last resorts. It's a tablet
Yeah.
that you take, which is really strong, and it knocks your kidneys out. It will make you go to the toilet. Yes, it does have side effects: numbness, tingling,
Is
stomach
that
ache.
sweet kind of liquid? Is that the one?
No, that's glycerol. Diamox is
Oh, yo, that is terrible also.
anything that you put in your mouth that's given by your glaucoma surgeon is basically industrial strength. It means that they are a little bit stuck with the pressures.
So a little bit on quality of life. We talk about quality of life.
Yeah, that's a good one.
So this is actually when we talk about the glaucoma, the medication itself can cause changes in the quality of life. The disease also cause changes of quality of life. And what is from Mr. Daniel, your point of view, your quality of life, how it affects from beginning from the disease after start put the drops, how the drops affect your quality of life? Because you see, you say just now you went to theater also you put the drops. It's really no people go to theater to entertainment, but you are still really no the of course we have to follow the regular drops, but how it affect your quality of life in how
I'm
during
kind of, I'm kind of used to it because uh, I mean, in the beginning, yeah, it was a kind of a frustrating, irritating thing to do. But now there's, even when I was at workplace, in the morning, I have to do it like at 8:30 or something like that. I just do it in the room, in my room. So I just take it because it became a part of my life. But of course, early days it was like a kind of an embarrassing thing to do. And then sometimes putting the drop, sometimes there can be a white thing discharge, and then you got to go wash your eye. So that can take like at least about 15 to 20 minutes of your time off. But then as I was moving on, it became part of my life. So things that's when you apply drops. But a certain part of life has changed, and has also become a norm thing. Driving is an example. I really do not speed nowadays. I just keep to my norm, and I'm not on the fast lane. I'm always on the middle lane, or the slower lane. Most of the time on the middle lane. So I really do not speed because I know for sure that something is always. I feel something is blocking me, and there when I turn, then I realize there's a car there. Thank God I didn't turn right, but I know there's a car there. Now suddenly I turn, there's a car there, but then it blocks me, right? So that kind of lifestyle is always a worry, especially when it's driving. So I literally at night I try not to drive. If there's an important thing that I really need to drive, then I drive. Otherwise it's a grab, or I ask someone to drive me, especially at night, and especially if it's raining, even if it's raining during daytime,
Yes,
or
yes.
if the worst, if it's raining at night. So those kind of stuff. So I try not to do that, especially at night. So if there's a need, I ask someone to drive me to where I want to go, or I do a grab, something like that. But during daytime, I'm still safe. And then I will always pray that there's no rain, and I hope that I don't want to have any rain. So when I'm driving, so that part of thing, yeah, that's that quality of life, that had to forgo. So yeah, that part of thing. But basically, on my sports side, There's not much of change because I still do my swimming, I still do my cycling, I still do my walking or jogging. So that part has not changed. I mean, till now, thank God, it has not changed till now. Yeah, basically that thing.
How
But
about John? Just now, Mr. Daniel said about you early retirement. Is it because of eyesight you retired early,
oh, no,
or
no, no, no. Nothing to do with eyesight. Because after I turned 55, I just want to take a break off from working life, and yeah, no doubt I'm doing. I'm full time house husband, but yeah, I do something else just to keep myself busy. But that I decided long ago that I would probably cock off doing this 8 to 5 thing or 9 to 5 thing, and taking things and easy, and try to do more other works and so on and so forth. Yeah, no, it has nothing to do with my eyesight. No, no, that was not
Miss,
the
Miss
motive.
Dalvinder? You are here actually. Everyday red eye students. You have to face everyday students, teachers. Teachers like to ask more questions. So how you
Uh,
tackle?
I think initial stage, everyone is like, why are I so red? Why are I so red? If I attend any function, there was once this auntie told me, wow, you get high very fast, huh? After one sip, I'm like, huh? I told her I don't even drink. She said her eyes are always red. Then I say, okay, never mind. This is going to be a very long lesson. I'm not going to explain anything. I just smile, but I mean, that red eyes, yeah, it's always there. But I tend to carry cysteine eye drops to keep my eyes going. So if I'm going for any function, I put more and more to make it look clear and bright. So yeah, I agree with Mr. Daniel. Driving at night in rain is a big no. No, I don't drive on highways. Now that both my boys can drive, and I got so many other drivers in the house, so okay, I'm well settled. I still drive um, the normal routines. Okay, perfectly fine. The normal routes and all that, all okay. But if during the day, if it's raining, not so heavy, I'm okay. But not at night and raining. No, no way. I'm taking any risk. It's quite dangerous for me. I feel that sometimes you get these blind spots and all that. So that one. And yeah, red eyes. Yeah, it's the biggest problem. Red eyes. Now with the very hot weather, I don't know. Is it me? My eyes tend to water a lot, and you know, get more reddish look there. Yeah. Even my niece, my small 5-year-old niece, will say, "You always got pink eyes." Yeah. So I think so. It's normal. I think I have got tired, and people have got tired asking me. Let's live with it. So it's normal.
David, you want to ask?
No, I think it's been a pretty comprehensive so far.
Yeah, very
Anything?
good.
I think perhaps our two patients. Any advice we give to people out there who might be wondering if they have glaucoma? Any advice to your fellow glaucoma sufferers, maybe?
My 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 advice, my personal experience is seek advice. Go see your eye specialist, whoever it is. Rule it out early. Do not wait. Do not delay. Don't say tomorrow. Do it now, and just go see the doctor. Just rule it out. Don't wait for any symptoms. Don't wait for any situations like how I went through. But basically, it could be whether you're 40s or 50s, or you may having glasses and things. Oh, I'm still fine, I'm perfectly fine. No, you do not know what's in you actually. So to make it things better, as how we do a regular medical checkup for our own self, so do also a regular medical checkup for your eyesight and rule it out. Thank you, Dr. David. Yeah.
Yeah. I
Super.
think
Yeah,
I'm
one
going
more.
to
Sorry,
Daniel also.
just to ask Daniel. Daniel, you
So
said you still do the regular exercise. Do you think exercise help in maintaining your intraocular pressure? From your
no,
point
I
of view.
don't think so. I mean, I like what I have not taken any supplements, and I don't want to do that because, like what Dr. David says, you do not know what you are actually going into. That's one. But in terms of my regular exercise, I have not seen any difference in that. So it really it's two different things. I mean, I'm a frequent walker, I'm frequent jogger, cycling, and I love swimming, and so on. And so on and so forth. But then I don't see any difference in that, doctor.
Mr. Binder, anything you want to say to our?
I would say that if you notice anything not right or normal about your eyes, don't wait, go and get it checked. And if you are diagnosed with glaucoma, please be very, just follow what your doctor has to say, the eye drops and all that. Don't take this whole thing very lightly, because your attitude towards glaucoma can save your eyesight. And eyesight, your vision is very important to you. Very important. That's all. Thank you.
Good. There's one question. Does Planeta actually help to reduce IOP beside the eye drop, chimbrins, and cancers? Planeta is actually a IOP reducing agent. There's new drops available in Malaysia. It works. Some patients, I mean, it's the action of action is reduced intraocular pressure. It helps to reduce.
Yeah, I'm using it.
others. It's actually under a different family. So I think we are towards the end. Again, Dr. Dave, you want to say anything to our audience?
No, I think thank you everyone for joining us. Thank you to our two lovely patients, and also Dr. Suresh for sharing. It's been a great session.
Thank you to Mr. Daniel and Ms. Delbinder. Before and just
Thank you so much to both of you.
Likewise, Dr. David and Dr. Suresh. Thank you so much, Dr. Suresh, for inviting us to this platform. A good experience and sharing our experience. Thank you.
The thing is, our two patients said is, if you suspect of glaucoma, go and check and confirm you are not glaucoma. Okay, what you can do is do a self-assessment. Again, I'm telling this again and again. Do a self-assessment. Online platform, there's a lot of things that's available, information. Check. If you think you are in higher risk group, check immediately. That's what Mr. Daniel said. Immediately. Don't put it tomorrow. Tomorrow won't come. Do it as soon as possible. Get to know your glaucoma status, your eye status. There's no glaucoma. Then you peace of mind. No need to worry about all this what called the irreversible damage and blindness. So thank you to Dr. Devi, Ms. Delbinder, and Mr. Daniel. And thank you to all the audience for with us for the past 1 hour. We hope this section become a fruitful section for everyone. I mean, to all the audience who are online just now. If there's any questions, I think you all still can send to our Facebook page to clarify. Then I think here we end. Good night to everyone. Thank you and good night.
Thank you. Good night, everybody.
Good night. Bye-bye. Bye-bye. Take care.
Saya kemungkinan akan jadi buta kalau saya tak cepat-cepat. Doktor beritahu saya sudah terlewat 3 tahun.
Told by the doctor that I have this problem. Of course, I didn't know anything about it, but yes, the nurse there told me that people with glaucoma do go blind. So that was my biggest fear. Continuously came to the hospital, took my eye drops, and then also listened to everything that the doctor had to say.
Saya berharap penglihatan saya akan terus kekal, dan saya juga berharap masyarakat luar akan tahu tentang apa itu glaucoma dan apa yang penyakit glaucoma ini perlukan bantuan.
So to everyone out there, glaucoma is not the end of the whole thing, your life. There is so many treatments available. So do not stop or do not just stop seeking treatment, but go out there, look out for treatments, see your doctor, talk to them, and get the best treatments that are now available in hospitals.
Ini tak satu pun yang ku miliki, walau ku tak sempurna, kau tetap terus ada. Tiada kisah kau rasa susah senang, lalui bersama, percayalah aku kan tetap ada. Ini bukan hanya mimpi, dan tak pernah ku berhenti.
Hello, I'm Dr. Fang Seng Kiong, President of the Malaysian Glaucoma Society. I'm here to let you know that your dreams don't need to have limits, even when dealing with glaucoma. Every step you take isn't just overcoming challenges. It's like painting a picture where your dreams can come to life. So your dreams do not have any limits when dealing with glaucoma.
Pengesanan dan rawatan awal mampu menyelamatkan penglihatan anda. Segeralah hadir ke klinik mata berhampiran jika anda mengalami gejala glaukoma. Juga pastikan anda menghadiri program-program sayangan mata yang kami anjurkan. Kami sentiasa membantu, oleh itu sayangilah mata anda.
Kalau bukan karena